Hello, my name is Dr. Nezar Abuojaylah. I'm a diabetologist from Benghazi, Libya. The title of my talk is Libya's Journey Toward Diabetic Food Care, Success Stories and Lesson Learned. So this is Libya. It's a North African country with an area of 1.8 million square kilometers. It's the fourth largest country in Africa and the 16th in the world. The north is green in Libya, around close to the sea, but most of Libya, unfortunately, is desert or difficult to reach areas. Diabetes in Libya in 2022, according to the ADF, prevalence of 9% in adults, with almost 400,000 people with diabetes. But some studies done, the number may actually be more than 17% of the population. Which of these numbers are true, the incidence and prevalence is clearly increasing with time. Unfortunately, we can't really know the truth because we don't have a unified national registry of diabetic patients. Some steps have been taken toward this issue. Diabetic foot disease. We know that 40–60% of people that die of non-traumatic lower limb amputation is caused by diabetic complications. And 80% of this amputation in diabetic patients start with an ulcer. People who develop an ulcer have a 31% risk of amputation. Unfortunately, in Libya, this number is slightly higher at 34%. We have many problems. We are facing challenges we are facing in Libya. The first of all is lack of infrastructure. So we only have 5 specialized foot care clinics nationwide. There is lack of qualified doctors. So many patients rely on primary care physicians for foot care, not diabetologists, not podiatrists. And these doctors lack the necessary expertise. We have lack of multidisciplinary approach. Even in the above-mentioned clinic, there is no communication between the surgeons and the physicians, only referral. There is lack of awareness. So in a recent study in 2023, more than 50% of the patients stated they didn't know how to perform correct foot hygiene, and almost 70% demonstrated poor nail cutting practices. There is limited access to resources. So many patients struggle to afford the necessary supplies such as diabetic shoes, socks, and wound care products. And lastly, there is lack of education program. There is no systemic education programs for diabetes or for foot care in Libya, unfortunately. My personal story, I returned to Libya working as diabetologist in 2010. In 2016, I started my own first diabetic foot screening clinic in Libya, the first one in Libya. In 2021, I joined the Libyan Diabetic Foot Working Group. And in 2024, I attended the Diabetic Foot International 11th Train the Trainer course. The Libyan Diabetic Foot Working Group, established in September 2021. It's the first scientific group of doctors interested in diabetic foot care from various regions of Libya. We have 4 surgeons. One of them is a general surgeon, 3 vascular. We have 3 physicians, 2 endocrinologists, and 1 diabetologist, that's me. And we have 1 qualified nurse. So we have objectives and activities we are doing. We have 6 steps we'd like to take toward better care for our patients in Libya. So the first is training and qualifying medical teams. So we started taking these steps. The first one is the first scientific symposium held in Zliten in September 2021. It was a small affair, but it was our first step. The second one was the first Libyan Scientific Diabetic Foot Conference in Misrata in December 2021. This one was a little bit bigger. more than 100 doctors attended this conference. Even there was some the Libyan Ministry of Health attended, and also some coverage by the media. The first workshop we conducted in Derna in February 2022. We educated doctors, nurses, and even some patients in 3 days, over 3 days. We attended the trainers workshop with collaboration with Diabetic Foot Care Center in Nasura, Egypt, February 2022. They helped us a lot. We have really benefited from their expertise. Training and qualifying medical teams. We started then doing a workshop all over the country. First one was second one, sorry, was in marriage in June 2022. Then Al-Bayda in August 2022, and Misrata in December 2022, and Tripoli December 2022, and CERT February 2023, and last one was in Benghazi in February 2024. So we did a lot of education, but we were not only concerned about education, we were concerned about motivating the doctors so we can enlarge our group, expand our team to help us do more for the diabetic patients. The second step is establishing diabetic foot clinic. So one clinic actually opened in Sabha in 2022. Another one is preparing to open in March right now. We insisted that all clinic start with basic equipment, monofilament and tuning fork, and all the clinic has unified form, easy to write and easy to fill. That can help us later in doing research, and every patient receiving educational material in Arabic to help him later. So the third step is the step-by-step program implementation. So we are preparing to launch the step-by-step program, but we are facing some logistic problems. Unfortunately, the fourth, fifth, and sixth step, we are delaying any work toward them until we finish with the third step. So introducing an accredited postgraduate certificate, implementing a unified national registry, and providing equipment and medications will have to wait for now. So what are the key points and lessons learned? So there's poor knowledge and practice among diabetic patients in Libya. So implementing a comprehensive educational program for patient and healthcare provider can improve the awareness and early detection of diabetic foot disease before increasing the risk we increase the risk for amputation. High prevalence of risk factors for foot ulcers. There is a need for educational programs and better preventive measures. Regrettably, there is scarcity of research on diabetic foot conditions in Libya. There is a need to increase the research on diabetic foot condition in Libya in order to better understand and address this issue. Thank you for your attention. This is my email if you want to contact me for anything. Thanks. If there's time, please check some photos from Libya if you. Thank you. Thank you and goodbye.